Explore Gombe. Welcome to Gombe State, the jewel in the savannah, the rising star from the northeast. Gombe State was created 1st of October 1996 out of the former Bauchi State, covering a total area of about 20,265 square kilometers. The state has 11 local government areas and shares common boundaries with Bauchi, Borno, Yobe, Taraba, and Adamawa states of the northeastern geopolitical zone of Nigeria. The state has relatively about 18 local languages, vegetation that is predominantly of Guinea savanna type, an average rainfall from 700 millimeters southwest at the extreme northern part of the state to 1,000 millimeters towards the south and southwestern parts of the state. The state has so much to offer, from natural beauty, historical heritage, to cultural diversity. The capital is fast-growing, and in meeting the demands of the fast-growing city, charming boutiques have opened, schools, universities for quality education, hotels for your decent accommodation and classy hospitality, bakeries, joints for hangouts, good restaurants, also that offer local and continental cuisine to cater for your indigenous and international taste. No doubt, your taste buds will have a story to tell when you pay one of these eateries a visit. When it comes to marketing, the state offers best opportunity for business to strive. With its rapid growing economy, northeastern central location, about 3.5 million population of consumers, it is an important target destination for local and foreign products and services. New modern markets and malls have also opened within the state. With recent discovery of crude oil in Kashiri and coal in Bojude, mineral resources tapped and yet untapped, the state is a potential hub for investors, and investors stand to benefit from friendly investment government policies, comfortable atmosphere for business, quality roads, and airport linking the state to the rest of Nigeria and the world. Explore Gombe is the window where you see the abundant talents, natural beauty, cultural diversity, and historical heritage in Gombe. Explore Gombe, to connect you to Gombe from diaspora, to connect investors to Gombe, to connect tourist visitors to Gombe. We take a look into 2 years of unprecedented achievement of Governor Muhammadu Inuwayahaya's administration, and also the message of His Excellency to the people of Gombe State as we celebrate 25 years anniversary. Explore Gombe. Explore Gombe. Explore Gombe.
Have tried to improve by the day, but we've not seen it so much until this present administration. For whatever reason, we've all known since then Specialist Hospital Gombe has only been bearing the name Specialist, but we've never enjoyed the accreditation of it to be called Specialist Hospital, where internship can be conducted. Now, with the coming of this administration, it was remodeled, it was reconstructed, and the accident and emergency was unit was developed. Then we have inputted machines to service the facility, especially in the X-ray unit, dialysis unit, emergency pediatric unit, and the theater. All these areas were, then the laboratory, which is the engine room where you make diagnosis, was also this. Then the staffing, we had to recall all our consultants and senior registrars to come because we are going to start internship training. Gombe State equally graduated 22 medical doctors of Gombe State origin, Gombe State extraction. And this is the first time the Nigerian Medical and Dental Council came in and saw the development and approved the center for conduct of housemanship or internship. This wouldn't have taken place without the immense rehabilitation, renovations, reconstruction, and construction of structures, then manpower, then equipment, then monitoring and supervision by the ministry. It now rose the standard, and when the Nigerian Medical and Dental Council came, they were able to approve that place for this. So you can see over the years. Now, it didn't stop at only specialist hospital. We now took at least one hospital in the geopolitical zone, one in Kaltungo, one in Kumo in Gombe Central, and one in Bajoga in Gombe North. The one in Gombe is service every one. So those hospitals were also placed on the highway, Gombe-Yola Road. There are a lot of road traffic accidents and there are a lot of emergencies. So we need to produce a structure there with personnel that will service such elements. And it's also a training ground. We have a lot of schools that require to do their practicals in such centers. So we need to improve those centers to make them centers of excellence for training and service provision. Thank you very much. You see, like I told you, when we first came into Gombe State, I was telling you what was there 25 years ago, into 15 years ago, 10 years ago, and today. Attempts were made to this, but attempts were not holistic. So when His Excellency came on board, during his electioneering campaign, he went around all the nooks and crannies of the state, and he saw for himself that there were inadequate manpower. There were also the structures were severely dilapidated, and there were inadequate healthcare equipments. Then there were also insufficient running costs, and the morale of staff was quite low. These were major problems. So he formed a committee very quickly and went around again to confirm what he got during his tour. And he now said there's going to be a holistic approach. Hitherto, maybe we take one sector at the expense of the other. But when you take all the sectors together holistically, because absence of one will not get the result for you. You need to improve on the manpower, you need to improve the structure, you need to improve the equipment and sustain availability of drugs. Now we reject the State Primary Healthcare Development Agency, and for the first time we were able to take at least one PHC per ward, and we renovated within the year 114 primary health centers in the 11 local governments of Gombe State. Well, we celebrate 25 years of Gombe. I would say the health industry has seen tremendous progress. Hitherto, the general hospital we inherited when we came in from Bauchi was merely a consulting clinic and a very small, rudimentary, obsolete equipment. We have evolved over the years into the present day Gombe to have the larger Gombe, not only facilities at the state level, but the Federal Teaching Hospital and the Gombe State University Teaching Hospital, and the Gombe State College of Medicine, and other institutions where we are building, producing the relevant manpower required. So we have come a long way, and I will tell you that for the first time, Gombe State has harvested 25 medical doctors of Gombe State extraction, and they are currently doing the housemanship in Gombe State Specialist Hospital. This is a very giant stride. This is a very giant stride in the health industry. Now for His Excellency, the Executive Governor. I wasn't surprised because he said health is his #1 priority. Health, education, agriculture. Now, with all these inputs, what I want to commend him or to thank him is he matched his words with action. If you say you are going to take health issues, you must back it up with the relevant funds. And His Excellency, the Executive Governor, got at least 15% of the budget onto health. And he never stopped there. He went to the headquarters of the United Nations to seek for partnership with all development partners, UNICEF, UNPF, UNFPA, UNDP, UNIDO, WHO, mention it. He interacted and paid counterparts for all health activities and other related matters so that Gombe State will benefit. Now you see the number of development partners coming into Gombe to partner with the state government to improve the health indices. This is a great feat, and I want to thank him for the foresight, and I also wish the people of Gombe to take the opportunity to always give support to this administration so that better dividends of democracy in the area of health delivery will be given to them. I want to also thank the large number of hospital personnel that during the course of COVID worked 24/7 in order to combat the situation and to make us reach where we are today. Without them, we couldn't have reached this level. All the key personnel that were involved in surveillance, in case management, in risk communication, and also logistics. This team has worked marvelously well in all our settings. I also want to thank the traditional institution for the support they give the Ministry of Health in reaching out to the community when we knock onto their doors.